Good day, global citizens. Welcome to another episode of the Fajembola'S Opinion. I'm so happy to bring in the first Southeast Asian to the platform, and please join me to welcome Professor Nikita. Professor Nikita,
Yes,
how are you doing?
Yunita. So if I can introduce myself first,
Don't worry, I'm
is
going
it
to
okay?
introduce you. Don't worry, I'm going to
Oh,
introduce you.
okay, okay.
Just answer if when I ask the question, just answer. How are you doing?
Yes, yes.
Okay, let me briefly introduce Professor Nikita. She's a public health lecturer and midwife practitioner with over 10 years of experience in maternal and child health, focusing on health promotion, early childhood growth and development, and reducing maternal infant morbidity. She has experience as a consultant in the Bank of Indonesia, also a consultant at USAID. She's the founder of Koala Home Medical Care. She's also a medical assistant at Peace Corps USA. She has elaborate teaching experience at Medistra Health Institute with public speaking engagement and gender-based and trainings on gender-based violence. Welcome on board, Professor Nikita. It's a pleasure and an honor to have you on this platform. Before I go into the discussion to start asking you the questions, I would like to look at some tweets regarding what our topic for today, which is precision medicine. So the first tweet I'm getting is from VJ Oncology, where they discussed cfDNA as emerging biomarkers in neuro-oncology. CSF and plasma open a new paradigm for precision medicine, enabling biomarker detection, response monitoring, and personalized care. The second tweet is from Wafik S. Elderi MD. That's his name. And his post on precision medicine is it was a personal trump to be at this top cancer summit for novel therapeutics in oncology and precision medicine in cancer meeting in Las Vegas and deliver my first talk since my 8-hour open heart surgery at the end of July. It went very well. The last is from F22, where they said Tempus AI stands to gain the most from the AI infrastructure build out thanks to its vast healthcare data assets and advanced AI models that drive precision medicine. So let us go to today's discussion, Professor Nikita. I've known precision medicine for a while, which I appreciated, and I really appreciate that there is a notable research gap existing in translating genomic insights into actionable therapeutic strategies within diverse clinical settings, which is one of the reasons why I started Dr. Fajembola'S Opinion, like making this research work like yours on very understandable to the layman and people outside science. Genomics is a rapidly developing aspect of medicine, which we all know. And as someone who comes from the global south, I would say it's a need. I can confidently say like 95% of Africans have no information on their genomic data. So, Professor Nikita, the first question for you is as a public health lecturer, what ignited your interest in precision medicine?
Yeah. Actually, I have been interested by the genomic machine to help people to curate it more and prevent any this for the long term. And as a public health practitioner, especially, we have community at International Association of Public Health Logisticians, then I think with the genomic and precision medicine, it will help the broader field, the health worker, health workforce to be more precise and find the good medication, the good prevention before the sickness becomes severe. So we can prevent from now as a public health practitioner. We really need to prevent the things to be severe sickness, and I really hope that my interested part of the precision medicine will help a broader health workforce in another countries with my uh, literature review and research. Yeah.
Okay, thanks so much, Professor Nikita. Would like to know what is the cost effectiveness or price of precision medicine compared to normal medical practice we have done for centuries in terms of management. What is the price? Is it cheaper? Is precision medicine cheaper than the normal practice of medicine, or is more expensive?
Yeah, yeah, absolutely. There is no one answer precisely for the cost effectiveness to help precision medicine develop as well, because it needs a very stable condition for from the another environment, politics, economic, right, and another innovation from the technology side, not just technology of the health itself, but the informatic uh, technology from the computer and the data science also showed relevant, and then we can develop and have any kind of large space for precision medicine to be developed in a very middle low and low income countries be more effective, right? And as we know, there is many factors that can evaluate for the effectivity of the course, right? The first one is if the sequencing price decrease, and then the the fees of the interpreted and the variant of uncertain significance, and the the technology, the machines, right, and the availability of the therapeutic medicine itself, it should be more balanced and have a full capacities in the health system. And then we have the pilot program in the broader scale. So any kind of those factor will evaluate how efficient our budget, our fiscal year in the countries make the cost effectiveness on these precision medicines. Yeah.
Thank you so much, Professor Nikita, for that. What are three things you want global citizens, people in Indonesia, people in Nigeria, people in Thailand, to know about precision medicine? What are three things you want us to know about precision medicine?
Uh-huh. So uh, doctor mentioned about where is the portion of the Southeast Asia for the precision medicine
Yeah,
in
three
another
things you want
decade.
us to know. Yeah, three things you want us to know about precision medicine.
Oh, three things. Okay, yeah. The three things that we should know as a global citizen for the precision medicine, I think the first one is about the knowledge of DNA tests, because the tools of precision medicine is the DNA, genetic, the genome. So if the system and the knowledge is good for the genome, the clinical data, and bioinformatics and public policy, or DNA precision mechanism, and then we should be okay to develop the precision medicine in any countries. Okay, and another thing, the second one is the the big the big impact with the universe. It should be balanced, right? Support system of the universe, the impact from the precision medicine, it should be relevant. Yeah. How it could be more relevant, Doc? Based on the literature review and any research in the developed countries, it should be have a smart technology for support matching the genetics variant to certain mechanism, and you know, we cut some codes of DNA, we cut some codes of the molecule itself, and then we prevent the cancer, we prevent the monogenetic, the pharmacogenomic, and we prevent them to. It's just about when we find the good way to match the DNA, the health one to be the health one, and we the sick one. Yeah. So the third one is really most important about the access of the issue. If you raise the issue in the countries and we stand together and we connect through the technology and the funds, like, United Nations have a very compatible technologies and the funds to generate the plan for any countries, and such as Southeast Asian, Thailand, Indonesia, right, Myanmar. So the access is really important, and the same like access is the ethic. Yeah. So how we can do and start the technology of precision medicines with the ethics and good policy, and who's the part that can make the ethic is really uh, nice. It should be government place, so government have a very necessary role to uh, plan the how is the best procedure to do the laboratory and start to precise the medicines with DNA system. I
Okay,
think
thank you
that's
so
the
much,
three.
Professor.
Yeah.
Thank you so much, Professor, for that elaborate answer. Where do you see precision medicine in Indonesia, especially Southeast Asia, in the next decade? Where do you see precision medicine of Indonesia in the next decade?
Yeah, to be more realistic, I think from 5 up to 10 years later, we will see the growth of the precision medicine lab project, and the project developed from the one project to be 10 projects, and it mirrored to another country. When Indonesia succeeds with the one project, and another country will follow with, of course, with their fund and fiscal year budget to get cost effectiveness. And then we have uh, many of referral center in the hospital, and we have a specialized and really central place for doing a genomical lab, right? And it's supported fully by Indonesian, by the government fundings, and also international funding such as uh, United Nations or WHO, right? To prevent the cancer, and you know to reduce the morbidity rate and reduce the mortality rates of the metabolic long-term disease event, right? Yeah,
Thank you
I
so
think.
much, Professor, for
Mhm.
that answer. I was optimistic about. I didn't know the answer to the question. I know Southeast Asia is developing rapidly in terms of technology, in terms of precision medicine. So I was optimistic, and with your answer, it's reinforcing my belief that Indonesia would be in a better place with more impact in the field of precision medicine in the next decade. Professor Nikita, I want to know what challenges are there currently in precision medicine in Southeast East Asia. What challenges is Southeast Asia facing currently in precision medicine?
Mhm. Mhm. the most challenging part for the precision medicine in Southeast Asia is we should frankly talk about infrastructure and the human resource itself, because the health workers that really born as a skilled worker, not just because of the degree, not just because of the education of the background, but really have a skill for doing genomic laboratory, right? And bioinformatics and also data science for the really skilled worker like that. We should increase that first, and that's really challenging for us, right? And another thing is about the funding also. Yeah, the funding, especially from international fundings. Uh, we should have a very uh, humble and kind partnership with uh, the government organization from another countries, and also from other foundation, right, that can fund our project. And the third the third challenge is that about the how how harness the data, how is the data to be fair for every uh, transparent data, and the regulation behind of that, the privacy of patient data, the profile of the patient, there is a very clear regulation, and we still develop our regulation for that, and it's still our challenge in the Southeast Asia. And the fourth challenge that we feel to be start to struggle, to develop our project in genomic precision medicine. It's about the how how is the rate of the population in South Asia really mirroring the target and the goals of the precision medicine itself. Yeah. So, and another factor is because there is some population do not want to join with the this project as the as the patient to develop our genomical laboratory. As a voluntarily, we still struggling to find the patient that can uh, check their physical to the laboratory system, and we still have a health promotion to let the population join with us. Yeah,
Okay,
I think.
Professor Nikita, sorry, what significance can precision medicine have in low and middle income countries? Low and middle income countries like Nigeria, from places where I come from, what significance do you feel precision medicine can have?
The precision medicine is really useful for the low and middle income countries such as Indonesia. We are in the middle right now. So why it's so useful? Because if we succeed with the projects of precision medicine national, yeah, it will have a very big impact to reduce the mortality and morbidity of mother and newborn births because of the effect of metabolism long term, such as diabetes, cancer, the chance to get stroke, heart failure, something like that. So the precision medicine is really useful to prevent the rate to be increased, right? And another thing is about the research of the efficiency of the treatment, because the treatment will take almost and more than one third of our physical year every year. So we can everybody in the hospital when they're already when they are already sick and sickness because of diabetes, because of uncontrolled uh, diabetes to get addiction. Right? So we need to prevent and decrease that uh, wasting budget, to get treatment for everybody.
Okay, thank you, Professor Nikita. Is there any difference between genomic and precision medicine? Because genomic, because you kept repeating genomic in the paper. Is there any difference between genomic and precision medicine?
Absolutely. This is a very interesting question from Yunita. So literally, genomic medicines is about the genome information that individual has for themselves. And let's say, for instance, the DNA of a doctor, it's different with my genome information.
Yes,
So each
exactly.
individual in each population that's different. And the precision medicine has a broader definition more than genomic medicine. The precision is about the proteomic, the metabolomic, and environment, and also because of our lifestyle, and the clinical data to protect ourselves and prevent to get the treatment and therapy for a long term. So precision medicine is our goals, and genomic medicine is the tools to get the precision medicine.
Thank you so much, Professor Nikita, for that explanation. We're shedding more light on that. Genomic sequencing came up frequently in the paper. Is it different from next generation sequencing technology? Genomic sequencing and next generation sequencing technology. Is there any difference between them?
Difference between
Genomic sequencing and next generation sequencing technology.
Okay. Yes, absolutely. There is difference between genomic sequencing to the next generation sequencing, because genomic sequencing is about the process that when we read the DNA sequencing and the genome, and then it it involves the all of the genome sequencing, right? And the targeted that we can check. But the next generation sequencing, that's the next phase of our process. So the first phase is genomic sequencing, and another phase that we need to succeed is NGS. But NGS is really, honestly, really need the more modern technology, and it's kind of, we cannot do NGS if we do not succeed in genomic sequencing first. Yeah.
Okay, thank you so much, Professor, for that explanation. I'm optimistic with more technology and more funding in the field of medicine, we'll be able to bring in the next generation genomic sequencing technology. Professor, from the paper, you and your team said by examining genetic variations and mutations, genomic insights provide critical information about how genes influence health, disease susceptibility, and responses to treatment. Please shed more light on this.
Uh-huh. Yeah. So elaborate the things that doctor mentioned before. It's about to check the genetic variation, right? And how the genetic will affect our health and our vulnerability to get sickness and the response to the treatment, right? If we have a very good sequencing genetic with the protein perfectly, with the all the genetic is health, you know. So if one day we get sick, it become a really like mild sickness for us, because uh, the the, the sick, let's say the sick of DNA sequencing that we cut out through precision medicines. After that, we get the medication, and then the level and the grade of medication, uh, it's not in the severe phase, you know, because we already done the genetic variation. We renew, you know, like we renew the DNA, we renew the genome to be like a new human without the cancer risk, without the diabetic risk, without the stroke risk, you know. And then our response to the new medication also will be more easier to recover, because we have a renewed DNA and genomic through the precision medicine. And it's already calculated to match with only ourselves, because our DNA is already read by the machine and technology for the specific medication that we need. Yeah. And the things is about the population impact is uh, the many things of variant will have a big impact with each individual. Like I said before, the monogenetic disease as the example give a very small variant, but together tend and evac the risk of diabetes and hypertension complexity to be more decreased with the precision medicine. Yeah.
Okay, thank you so much, Professor, for that elaborate explanation.
Yeah.
I believe our audience are understanding the paper with more insight. Professor, where do you see a future of precision medicine in traditional medical practice?
Mm.
Do you see a
Oh, the
future of
future.
precision medicine
Yes,
in traditional
absolutely.
medical practice?
Yes. The future of the precision medicines for the medical practice and traditional medicines, yeah, it cover specific innovation in finding the plants, the herbalism for doing more humanized treatment without chemical, with without chemical effect from the capsules or tablet with antibiotic, because we have so many plants that offer us really natural effect of antibiotic without the chemical effect. So with precision medicine, it will make more perfect result for traditional medication, and it will make uh, the easy work to the workforce, because we don't really need to touch any kind of chemical nowadays. Yeah, because of the radiation, right? So I think the future it's really there. The future is really there, and we almost reached in there. We just need any kind of support from the population and the government and the fundings to uh, to finish our precision medicine laboratory project for a long time. Yeah.
Okay, Professor, thank you for that. Thank you for elaborating the role of relevant stakeholders in moving precision medicine to the next level, making it accessible and also impactful in this generation. Professor, the last question for you is I talked about relevant stakeholders, and you've discussed this. I believe you have something different to say about it, because it's like I'm repeating the same question. What role do you feel relevant stakeholders can play in making um, genetic medicine an integral part of patient management globally? I
Uh-huh.
believe it's a add up to what we just discussed.
Yes, 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 absolutely. If we talk about the partnership and the stakeholders that I mentioned before, the first one we talk about the regulation and who is the regulator behind of the regulation. Of course, that's the government, right? So the first stakeholder needs to precise the reward and maximize the reward is government as a regulator. So I hope the people would hear us through your platform, Doc. So every person in the countries would stand together and support this precision medicine ideas and long-term plan. So for the regulator, we should make sure the fundings and the policy support us, give like maybe not just 5 year budget for establish laboratory in any kind of municipalities, especially in Indonesia. We have more than 365 island, so
Wow,
we are,
wow.
yes, we are just developing and establishing the laboratory center in each island, each municipalities, and it will take very big fundings. I do believe that. So the regulator should be strong in that. And another thing we consider about the stakeholder is about the hospital and another uh, healthcare service provider. Yeah, because the user, the user and the helper of the population uh, for increase the living rate of the population, of course hospital and healthcare service providers. So we invest, yeah, people should more if investment through the infrastructure such as laboratory and IT, data science, and doing training for the clinical health workforce and the genetic counselor. In developed countries very we have many genetic counselor, and we compare to Indonesia, we are still developing that course to be a genetic counselor and the data integrated genome to be a medical record electronical. So we have electronic medical record. We are still developing that one through our stakeholder. Then another stakeholder need to consider to get succeed behind of precision genomic is the researcher like uh, myself in academia or lecturer, professor, yeah, and teacher and trainer even. We we really need to grow and develop the clinical approach for local that uh, that that give us chance to get cost effectiveness, right? And then we collect the reference of a local genome and population in Southeast Asia. We let people to come on, let's uh, join and register yourself to our laboratory, and we can take your blood and we check the chance of you know systemic metabolic disease that you will have for next 20 years later. You want to join with us? It's something like that. So we promote through our knowledge and our methods, right? And another stakeholder is the industry, the insurance industry. uh, I consider to they should support the project of genomic in the fundings, and not only benefit for the treatment but benefit to prevention. Yeah. So the coverage to test, the coverage for not just treatment but for prevention. Okay. And the last stakeholder, I think, is about the society. Yeah, society and the patient as a part of society. So we educate the population, we educate the patient how is the precision medicine will take a risk, and the information for you know uh, we inform the patient very well, and the patient will understand for that. I think those are the stakeholder that will support precision medicine to be successful. Yeah.
Thank you so much, Professor Nikita, for breaking down this publication in a very simple way. Actually, your explanation of the paper is quite elaborate to what I understood on it. Thank you for spending your time with us. I know you are a very busy person. You're a very busy person. Thank you so much for giving your time, sharing your time with us, sharing your knowledge with us, sharing your expertise with us. It's an honor, and we are grateful to you for that. So, global citizens, we went through Professor Adenekita's paper during the week. Please go through the paper after watching this. Also share with your colleagues, discuss with your colleagues. Precision medicine is an evolving and rapidly developing aspect of medicine. And what we encourage is innovation in medicine. So we should not only talk about government coming in, international NGOs coming in terms of funding. Our way of also contributing is by discussing and getting relevant knowledge we can on precision medicine. I know in terms of genetic counseling and or genetic sequencing, especially in lower middle income countries, it's still not really accepted. It's not really funded, but I believe with more people getting awareness from platforms like this, we'll get more funding, more investment, more collaborations to improve the health of global citizens. So thank you once again for joining us on this episode. We know what we are, where research, Dr. Fajembola'S opinion is a platform where research meets understanding. And basically, the larger mantra is each one helping one, and I believe this is one of the ways we can help each other by sharing, discussing, and impacting ourselves positively. Have a blessed week, everyone.